Hello everyone, I'm Julie and I'm an Improvement Advisor with Healthcare Improvement Scotland's Focus on Dementia team, and I'm delighted to have this opportunity to share our experience of engaging carers in our improvement work. A bit of background, our work spans 3 areas, and these areas relate to aspects of the experience of living with dementia, from the point of diagnosis to hopefully receiving post-diagnostic support, and we call that PDS for short, to the time of needing more supports to be able to live well in your community, and that's what we call care coordination, to perhaps then needing to spend some time in an inpatient setting, whether it be in an acute ward or a community hospital or a specialist dementia unit. And in the middle there, we have what we call our learning system. And that's just how we share the learning from our work, for example, through events like this, webinars and improvement tools, and also our networks. Just a wee bit about why our work matters. So you see on the slides there quite a few facts. It's estimated around 90,000 people with dementia live in Scotland, and 3,000 of those are under 65. And those numbers are set to double in the next 20 years. And Scotland has a government target for post-diagnostic support. So it's a specific type of service that people with dementia are entitled to following the diagnosis. But the data shows less than half of the people in Scotland who are newly diagnosed are actually receiving this support. And there's also variation in the quality of dementia care and support. So our work is really very much about trying to drive up the quality of what's happening out there. But the vast amount of dementia care is provided by unpaid carers. And just a couple of facts around that, around 60% of people with dementia will live at home with the support of unpaid carers. And it's estimated that 1 in 3 people will care for a person with dementia in their lifetime. And these last 2 points on this slide here are very relevant for the focus of hospital discharge planning. So at any one time, 1 in 4 acute hospital patients is a person with dementia. And high levels of stress and distress in hospital is experienced by people with dementia. And things like lack of power of attorney can lead to guardianship issues, resulting in delayed discharge, safety issues when people are maybe more prone to falling, infection, delirium, if they're kept in hospital for too long. And generally, there'll be poorer outcomes for people with dementia with delayed stays in hospital. Throughout all of the work that we've done in focused dementia, and we're continuing to do, we just couldn't have done nearly as well if we hadn't consulted and involved carers from the outset. Our main connection to carers of people with dementia has been through NDCAN, which is the National Dementia Carers Action Network, which sits under the auspices of Alzheimer's Scotland. And we also connect with others where we can, and with individuals who might not be part of such a group. We tend to have set meetings with NDCAN throughout the year to hear what their campaigning priorities are, and to check that what we're planning to work on is going to help. Because there's no point in us slogging away on what we think needs improved and what will help if it's not a priority for people living with the condition. And that's really one of the foundations of improvement work. Seek to understand before you start, and also to really value people's experience. And this quote from one of NDCAN members in relation to our work to implement dementia strategy applauds us for involving people and says, "Sharing our experiences helps people to understand how services impact on our lives in both good and bad ways, and our insight helps to make these services more effective." Some examples here of where carer involvement has kept us right. And please note that carer involvement doesn't always entail meeting with big groups of people all of the time. Much of the work on here was done with a few individual carers who represent wider carers. I did a lot of work with the help of one carer, Myra Lamont from NDCAN, when I was developing the quality improvement framework for post-diagnostic support. That's the document you can see there on the left. It's a self-assessment tool for services to gauge, what kind of quality are they delivering and where could they be better. So I had the view at the time that it would be a useful resource for everyone, professionals and people with lived experience. But Myra's insight made me realise that was just not going to work at all. and that we really needed a separate resource for individuals, which resulted in the purple guide that you see there, the Making the Most of guide, being produced in collaboration with the bigger NDCAN group. And I'm pleased to say it's still one of the most popular resources that Alzheimer's Scotland distribute. And everything else on here we just couldn't have done without carer input for designing, testing and finalising. In relation to the focus of this event, my colleagues recently concluded a Dementia in Hospitals programme, and this programme focused on improving person-centred care planning to support a reduction in stress and distress for people with dementia in hospital. And a key feature of that work was involving carers. The work identified 6 high-impact changes, and that's the poster there that you can see on the right. And point 3 says, involve carers in collecting person-centred information, ensure information is collected at a time and in a way that suits carers. And many of the teams involved in the Dementia in Hospitals work focused on using a document called Getting to Know Me to gather person-centred information about individuals. And they introduced processes to ensure that the document was completed. And as a result, there were many different areas where we saw improvement. And the most significant included reduced stress and distress, reduced falls. For example, there was 75% reduction in falls in one of the areas in Grampian. And as well as the benefits for patients and their families, there were many examples of the impact the programme had on participating staff teams. And that was including reports of improved morale, job satisfaction, reports of saved time for staff because of reduced stress and distress, and reduced complaints from families because they were more involved. Just a wee bit about the Getting to Know Me document. It's really well known, and it's a well-known tool in dementia circles. It's been around for a long time, and it's on Alzheimer's Scotland's website. So the person should bring this into hospital already complete, so that it can make a difference to their hospital stay. But often it's not used, not completed well, or there are no clear processes to embed it and use it. Ideally, hospital staff need to see this coming in with the person, and if there isn't one, then they need to make sure one is completed. So, if you can, help people and their carers to have one completed before admission, so that it can inform person-centred planning right away, and potentially prevent issues that lead to prolonged hospital stays. I mean, this slide just shows 3 sections of the 6-page document. The last section on here specifically asks the carer how they'd like to be involved in the person's care. So an example here from the Dementia in Hospitals work. So Ward 3 in Glenrothes Hospital in NHS Fife, the team there developed a whiteboard in the ward with lots of information about dementia. And on it, they included an example of a completed Getting to Know Me document that's circled in yellow on the slide there. And when a person with dementia was admitted to the ward, the nurse in charge would take the family member over to the board and explain what the Getting to Know Me was. She showed them the completed version and explained how the information would be used, why it was important and the difference it can make to the care the team are able to provide. But the team found that this relatively small change meant that forms were returned by carers and they contained much more detailed personal information about what was important to the person. And they included activities that would help the person settle or preferences such as whether they preferred a bath or a shower. The information was used in developing person-centred plans, which were then used in planning meaningful activities for individuals. There were some really nice examples of the difference this made to patients and their families, including a gentleman who liked to play a mouth organ, and he had this brought into the ward. Staff supported him to play his music, which helped to reduce his levels of stress and distress, and others in the ward enjoyed the music too. So here's just a quote from the family member. So, thank you for letting my dad be himself in hospital. He is happy with his mouth organ and it helps his stress. And another quote here from that work from a senior charge nurse. We can see that improvement. It's really made me think about the Getting to Know Me document and how important that document is, because if that's in place and the family involvement is there, then it's a much better journey. The increased engagement and understanding benefited both patients and carers. And a final quote here from a staff member, and we now have a much better relationship with families with regards to patients with dementia or cognitive impairment, and we're able to identify stressors and de-stressors. So just some parting tips from me. So before embarking on improvement work, speak to carers to understand the issues. Make sure you're focusing on what matters. It isn't onerous at all. Working with one carer representative can often be enough. But stay connected to carers. Let carers know what difference their involvement is making or has made. Involve carers before the person they care for might be admitted to hospital, and make sure that getting to know me is complete beforehand, as it can help to support transitions and reduce the incidence of stress and distress. And see carers as an asset to the care of the person before and after they are admitted to hospital. And another important point I haven't added on the slide here, but it's important to say, is recognise that carers come with a lot of other assets. It's not just about sharing the carer experience. Certainly when I was getting help to develop some of our resources, carers came with the ability to proofread, making sure things were in plain English, things around design and layout. So they came with lots of other talents that I really benefited from their involvement. So thank you. That's all from me. But if you want more information on anything I've said in this presentation, feel free to get in touch. And there's a link to the improvement work here included on this slide. Thank you.